Hey, Wellness Warriors. Welcome to the Burnout Resolution Podcast. I'm your host, Dr. Mylaine Riobé. And today we're diving deep into part 2 on perimenopause. Why it's not just about hormones and a whole lot about stress. We're going to talk about why perimenopause isn't some rite of passage that we're supposed to suffer through for years and years just because we're women. We'll talk about what's going on in your body when you're suffering through these symptoms and what you can do about it. So, in our last podcast, we talked about how perimenopause is just not normal. And just because your blood work is normal doesn't mean what you're experiencing is. So, if you missed that one, I encourage you to go back and listen to that one as well. We're going to talk about why perimenopause is simply burnout plus hot flashes and night sweats. When stress and burnout collide with a normal transition point in a woman's life, all hell breaks loose. And tens of millions of women are suffering through this time in their lives without the help that they need. There's so much confusion, misinformation, mythology around perimenopause and menopause that has a lot to do with how we're socialized to think that we're supposed to suffer through stages of life. There was a time when women would be ostracized during their menstrual cycles because it was thought to be a time when they were dirty, and there were menstrual huts and things like that built for women when they had their menstrual cycles. And so for hundreds of years, we have had our womanhood and important transition points of our lives demonized in many ways. And perimenopause and menopause are no different. So we're going to de-demonize perimenopause today, break it down into what it is so that you can start thriving in your life. So perimenopause isn't just about hormone fluctuations run amok. It's a deep cry from within your body that it needs help and that it is struggling due to years and years of stress. So your adrenals are these tiny, tiny little pea-sized organs that sit on top of your kidneys. They're supposed to be there just in case you need to go into fight or flight. If there's a lion chasing you, a bear, these little pea-sized organs get activated. They start making and pumping out adrenaline, controlled by the brain's responses in stress reactions. And of course, as we know, our modern lifestyles have caused us, and our brain in particular, to think that we are always in fight or flight. Again, the human brain doesn't know how to distinguish different levels of stress. Although we can categorize those different levels of stress, the issue is the same chemicals are pumped into the body regardless of levels of stress. It's the same adrenaline, the same cortisol. So ultimately, whether it's a traffic jam, an impossible boss, or an actual lion, the chemicals that your brain sends down into your body are exactly the same. And this is what wreaks havoc in a woman's body in particular. Men, as we talked about before, have a built-in cushion that women don't have, unfortunately. And again, it's not because we're defective or that something is wrong with us. It's that our biology is extremely complex and it was not designed for what we're experiencing in our modern day lifestyles. So again, I made a podcast about this very topic, why women have to work harder to stay healthy. So if you missed that one, I encourage you to watch that one as well. It explains why our biology gets worn down by modern living and how stress impacts us differently because of that. So we're going to talk about how to turn a distressful time in a woman's life into self-empowerment and transformation, which is what in fact menopause is supposed to be. Traditional Chinese medicine helps us map this out. In traditional Chinese medicine, it's taught that during the time of menopause, blood ceases to go down and out for menstruation and in fact comes up into the heart. So whereas between puberty and menopause, we are in our reproductive phases and we use our blood in preparation for pregnancies. And if we don't get pregnant, that blood comes down and out. In menopause, that ceases, obviously. And then our blood instead moves up into the heart. And so this is a time when women become even wiser because there's blood nourishing the heart rather than being split between the heart and reproduction. And so this is a time of great transformation for many women. Unfortunately, again, when modern lifestyles and stress collide with what should be a normal transformation and a smooth transformation, we get what we're calling perimenopause. Again, we should not know that we're in perimenopause. It should just be this silent, quiet thing going on in the background as we're going about our business, living our lives. It shouldn't be where we're gaining weight. It shouldn't be where we're anxious, not sleeping well, having hot flashes, having night sweats, being inflamed, having joint pains and aches, and all of the things that we rattle off as perimenopause symptoms. None of those should exist. And again, it's not our fault. It's simply modern living has its pluses and its minuses. So if we're not aware of the minuses and we don't prepare for the minuses, then those bowl us over when menopause comes along. Now, perimenopause typically will start upwards of sometimes 10 years before actual menopause. So menopause, again, typically occurs around the age of 51 and a half. However, many women begin to experience what they would label as perimenopause symptoms in their mid to late 30s. And again, we're not supposed to know that menopause is coming. So this is not really part of the menopause transformation. This is what happens when the stress symptoms are put in a vice grip because, yes, menopause is a fixed transition time. So it's not something your body's just going to kick the can down the road and put off until it can figure itself out and go through menopause. Menopause is a fixed point. So if there's all this stress going on and the body is getting worn out, eroded, missing vitamins and minerals, full of toxins, lots of inflammation, and again, you're moving through time, getting closer to this fixed point in time. Now, there's more and more pressure on your system because there's more and more stress, and there's nothing to rebalance the systems going on. So again, you're just moving through time as the body is out of balance, not functioning well. The closer you get to this fixed point of menopause, the worse you're going to feel. And this is what we're calling perimenopause, but that's not what it really is. It just happens to be temporally or time related to menopause, but it's not because of menopause. It's because of stress and the imbalances going on in the systems of the body that should be handling the stress and helping the body to recover from the stress. So when those systems have been so worn out or overworked for years and years, they just can't do it anymore. And those very systems are heavily involved with the menopause transition itself. And so they've been overburdened with all the stress and all the junk going on as the stress is ongoing and never ending. And now they have yet more to do when this menopause shows up. And they just fall apart. And again, this is why women tend to get sicker around the time of menopause. This is why heart attack rates go up in women. This is why cancer rates go up in women during this time. It's not because we should be demonizing menopause and thinking it's this horrible transition, because it isn't. It's how our bodies have been maladapting to stress that is to blame. And again, it's nothing we've necessarily done wrong. We all live in the same environment, so we're all living in the cesspool that's making us all feel poorly. Unless you know exactly what to do for the body to support it through those times of stress so that it's being built back up again when it's enduring the stress, it will just get worn out by the stress. So during the time of menopause, what's supposed to happen is the adrenal system, which is again the stress handler, they also make the same hormones that women's ovaries make. So they also make estrogen, progesterone, and testosterone. The issue is when it perceives itself to be needed for fight or flight responses, it can't do both. It can't do managing stress and making the same hormones as your ovaries. So it has to pick one or the other. And if it perceives itself to be in fight or flight, it will always pick the fight or flight responses, which means it's going to be cranking out cortisol and not estrogen, progesterone, and testosterone. So when we go through menopause, what's supposed to happen is the adrenal system is supposed to continue to make your estrogen, your progesterone, your testosterone, and your ovaries are supposed to wind down because we're done with reproduction. So we don't need the cyclical up and down of the estrogen and progesterone that the ovaries manage. Now we just need a nice little base cushion of estrogen, progesterone, and testosterone so that we have our baseline body functions still operating properly. But if the adrenals are not functioning well, they will not be making that cushion, that baseline of estrogen, progesterone, and testosterone won't be there because they were busy making cortisol. Now your ovaries are winding down. It's not doing the cyclical estrogen and progesterone that it was doing that brought on your menstrual cycles and allowed you to get pregnant if you chose to. Now they're winding down as they're supposed to. They're supposed to be able to go into retirement and have their 401k or their investment funds pick up the slack by making that estrogen, progesterone, and testosterone despite the ovaries retiring. But if there has been a lot of stress during the decade before the retirement date, which is menopause, you don't have that cushion. And that's where the hot flashes, the night sweats, and all the other symptoms come in. So if we're not doing things to turn that fight or flight off and helping the body to restore itself from having been in fight or flight, we run into all kinds of problems when menopause comes. And yes, it's doable. You can do those things. You can actually restore the body from stress responses and keep it functioning normally through the menopause transition. And we'll talk about how to do that today. Many women are told that menopause is just something they have to deal with, and it's part of aging and just suck it up. The reality is, yes, hormones will shift because they're supposed to, but symptoms are not supposed to happen. And those occur when the body has already been out of balance. So what you're actually experiencing are burnout symptoms, metabolic imbalances and disturbances that are going on as a result of stress. So again, burnout doesn't have to be work related. In fact, most of the time it's not. It's unmasked by the workplace, the same way that burnout is unmasked by a stressful work environment. In other words, there was already some imbalance going on before we ever started the actual work itself. And so when those two things collided, you ended up with burnout symptoms. It's exactly the same during the menopause transition, except menopause isn't a place we go to work, but it is a significant change in the body that unmasks the burnout symptoms. So it's the same processes going on. And this is why perimenopause is really just burnout with hot flashes and night sweats added on top. Stress hormones deregulate your thermostat on the inside and cause hot flashes and night sweats. So it doesn't have to be low estrogen that does that. Cortisol is a hot hormone. So if cortisol is too high, we can have hot flashes for that reason. And even if your DHEA is too low, so again, DHEA is dihydroepiandrosterone, and it is what we call the anti-stress hormone or the anti-aging hormone. Stress is what causes aging. It's not necessarily your age itself. So it's not how old you are based on the calendar. It's more what has stress done to you on the inside that manifests on the outside as your skin, for example. So aging isn't just a function of time. Aging is also a function of stress. So there is a hormone in your body that prevents aging by helping you to recover from stress, and that is DHEA. It is the balancer of cortisol. So I tell my clients cortisol is kind of like the bull in the china shop, breaking everything apart, knocking everything down. And DHEA is like the cleaning crew that goes after the cortisol, putting everything back in its place, gluing everything back together. So whatever cortisol does, DHEA normalizes. So cortisol will raise your blood sugar, it will raise your heart rate, it will put you into high alert, it raises your blood pressure. DHEA literally normalizes all of that. It normalizes your blood sugar, it normalizes your blood pressure, normalizes your heart rate. It calms you and grounds you and allows the body to go out of the fight or flight responses so that it can go into restoring mode or restoration mode, repair all the damage and get itself back up and running. So this is how stress damages the body. If there is not enough DHEA to normalize the stress responses because the stress responses have been going on for too long, then our DHEA levels will drop. When your DHEA level drops, you don't have that grounding, calming energy anymore. And now the cortisol is relatively even hotter because you don't have anything to quote unquote cool back down. And that can cause hot flashes as well. So you can have normal cortisol or even sometimes low cortisol, but because the DHEA is low, you'll have hot flashes and night sweats. The other cause of night sweats and hot flashes could be low progesterone. One of the reasons that the adrenal system can make progesterone is because it is the precursor to making cortisol. Your adrenal system will take the progesterone and convert it into cortisol. We know that progesterone means what the name says it means, which is progestation. So it's also important for maintaining a pregnancy. However, when the body perceives itself to be under stress, it will put that to the side and go into making cortisol out of the progesterone instead. And so this can consume our progesterone, and that can be another reason for night sweats. But that's not because of quote unquote menopause. That's not because your ovaries are, again, retiring. It's because the adrenal system can't keep up with making enough progesterone because it's perceiving itself to be in fight or flight all the time. Much of the stress that people are enduring is subconscious. They don't even know they're under the stress. I have this conversation with people all the time where they say, I'm not stressed. And yet we get their testing and they're completely stressed. They just don't know. Or even from the tongue and pulse assessment that we do, we can tell that they're stressed. They have liver qi stagnation and other signs of stress. Their tongue might be red with greasy, grimy coating on it. So we know that they're stressed, but they're just not recognizing that they're stressed. It's almost like a bypass to survive in the world. Because if we perceive ourselves to be under stress all the time, we wouldn't be able to function. And so many people will normalize their stress and think that they're not stressed because it is subconscious. The thing is, you can't BS your body. Your body knows it's feeling the stress and the tension. That's how we can see it on the tongue and pulse, and that's how we see it in your cellular-based testing that we talked about in the last perimenopause podcast. We can see these things when we look inside your cells. We can see them when we do a tongue and pulse because they exist, right? Because they exist on a cellular level. So even though you're not fully conscious that you're feeling stressed, your body's physiology is still going to be hijacked to perform stress responses because, again, your body can't tell the difference between good stress, bad stress, bypassing stress, normalizing stress. All of it is interpreted the same as stress. You can tell by looking at your HRV or your heart rate variability. Unfortunately, a lot of the smartwatches and the wearables label a lot of low heart rate variability as normal. Your heart rate variability shouldn't be 30 and 40 something milliseconds. It should be probably 60 or 70 milliseconds. So if you're wearing a wearable and you see that your heart rate variability is in the 30s or 40s, that's not good. And that tells you that you're stressed. Even if your wearable doesn't say that you're stressed if your HRV is on the lower side like that. And again, if we do that type of testing, if we do cellular-based adrenal testing with saliva, we will see that reflected. You won't see it in your blood work like we talked about last time, but you will see it in saliva testing, which is why salivary testing is so important. So these are some things that you can see with wearables, things that you can see for yourself without having necessarily formal testing done. But if you do have a low HRV or heart rate variability, you want to get that checked out because that means your body is being hijacked into fight or flight responses and not handling body function. Fight or flight responses and body function are different. Fight or flight is a distinct body function. It is one body function out of many. However, when your body's in fight or flight, it only focuses on that one function and it shoves the rest of your body off to the side in many ways. And so the rest of your body functions, like your thyroid, your digestion, even your executive function, your memory, your musculoskeletal system, your skin health, your vision, your immune system, your liver detoxification functions, those are all shoved to the side in deference to the fight or flight responses. And this is where the symptoms come from. It comes from the body being hijacked into this one mode, which is where you'll see the low HRV, you'll see the low heart rate variability because the body is hyper-focused. So heart rate variability is the variability of your heartbeats. So if you were to look at your heart rate on a monitor, you'll see that it never stays the same. It's never 78, 78, 78, 78. It will constantly be changing from one beat to the next beat. And that's reflected as heart rate variability. So low heart rate variability means that it's not changing very much from one beat to the next. It might be going from 72 to 76, and then down to 68, up to 74. It's narrow. It's only changing by about 6 beats per minute beat. So it's a narrow heart rate variability. On a wearable, you'll see that as 20 milliseconds, 30 milliseconds, something like that. Either way, it's showing that your body is very hyper focused. It's narrowly focused, which is why the heart rate variability is narrow. You want your heart rate variability to be very high or wide. You want your heart rate to go from 60, for example, to 80 in one beat so that your heart rate variability is high. That's when you see it at 60 and 70 milliseconds on a wearable. That means your whole body is engaged in functioning. That's what high heart rate variability means. It means my body is not hijacked, hyper-focused on fight or flight. It's actually widely focused on all body function. And that's when you don't have as many symptoms. That's when the body gets to restore itself and feel better. That's when your metabolism doesn't get worn out. That's when you don't build up a whole bunch of toxins and inflammation, because now your body can go into repair mode, because repairing is not done when we're in fight or flight. When we're in fight or flight, we're just trying to survive. The body doesn't care if it's getting repaired or not repaired. It's just trying to keep itself going, running away from the lion. That's what your body thinks you're doing, even though all you're doing is sitting at work, for example, or sitting in a traffic jam. Again, your body doesn't really know what's going on out in the exterior because it's led by the chemicals that your brain is sending down. And if you're feeling stressed because you're in a traffic jam or you're doing work you don't like to do, or you're too tired, for example, you're not sleeping well, or you're in pain, you have chronic pain or something like that, your joints are aching, things like that. That's all perceived exactly the same way by your body as a lion chasing you because the chemicals are the same. What's happening on a physiological level when your heart rate variability is low or narrow is that you're shallow breathing. If we're not consciously aware that we're stressed and we don't interrupt the fight or flight response by deep breathing, our body stays in fight or flight because the number one communication tool that your brain uses to figure out what's going on is actually your breath. It's not the environment. A lot of people think that the brain is focused in the environment, and if it detects a threat, it will respond. And yes, that is true. If a lion is coming at you and your eye sees it, that will trigger a fight or flight response right away. However, if you're shallow breathing already, that by itself will trigger a fight or flight response. Now, again, people will say, well, why don't I feel stressed if I'm stressed? Why am I not in panic mode and feeling like I'm being chased by a lion? And that is because your brain is intelligent, right? It will get the signal from your breath that it needs to start a fight or flight response, and it will send the cortisol down into your body immediately at the first sign of a shallow breath. Then your brain subconsciously looks for a threat, doesn't see it. So then it thinks the threat is over, and then it will dampen the signal. Now, you're in between breaths while all this is going on. So you haven't taken that next shallow breath yet. As soon as you do, the brain will send another stress response down into your body. And then it will look around again, won't see a threat, and it will dampen the signal. It's a really quick boom, I'm in fight or flight, and then, oh, it's over, and it's going to dampen it. So it's this, I'm in fight or flight. No, I'm not. I'm in fight or flight. No, I'm not. This is what every shallow breath does to the body. So again, you're going to swing it in one direction, then you're swinging it back in another direction. Now, again, this is science. This is not hyperbole. This is not fiction. This is science. This is what the science is actually showing us. Because your brain has to get the input of data to know whether or not it's safe, your breath is the first input of data that it actually uses to figure out if it's safe or not. So when you take a deep breath, what you're doing is you're telling your body that it's safe. When you take a shallow breath, what you're doing is you're telling your body that it's not safe. And it's binary like that. It's like flipping a coin. It's either going to land on heads or it's going to land on tails. There's no I'm half stressed and half not stressed. That's like saying I'm, half pregnant, half not pregnant. That doesn't exist in the world. And stress is exactly the same. So the body's inner thermostat is one of those functions it doesn't pay attention to when it's under stress. It's a non-essential body function for fight or flight responses. So that goes over here with all the rest of the body functions that are being ignored. You're going to be much more sensitive to having hot flashes and night sweats when that particular function is not firing on all cylinders because your body is hijacked in fight or flight responses. A lot of women think their hot flashes are like random events that happen. They're not random at all. They're your body sending you a very clear signal that it's in distress, that something is very wrong, but it just doesn't know how to heal itself. A lot of times that's because it's so stuck in fight or flight mode that, again, that switch to heal can't be turned on because we're not looking to heal when we're running away from a lion. We're looking to survive, right? It's when we are out of danger that we look to heal. And so the body will not heal itself when it's perceiving itself to be in fight or flight. And this is an extremely important thing for us to recognize during this perimenopause transition, because this is an opportunity to turn that fight or flight switch off. And it's your breath that literally does that. Then we can work on restoring all the things that were lost during the times when it was trapped in fight or flight. Vitamin and mineral deficiencies, getting rid of the inflammation, getting the toxins out, rebalancing the hormones. These are all things your body cannot do when it perceives itself to be in fight or flight. And again, this is all subconscious. It's not something that we're going to be fully aware of as it's happening, and that's the danger. And the more we ignore the milder signals when we're younger, like the fatigue that sets in when some people are even in their early 20s and they're just tired all the time. This is one of the very first signals that your metabolism is off, something is wrong. And if that signal is ignored, it just keeps adding more and more signals. As other systems get impacted, you get more and more symptoms coming in. And again, this is what adds up over time and hits us like a brick wall the decade before menopause, because menopause is a brick wall. It's not going anywhere. It's going to happen. Come hell or high water, women are going through menopause. So it is literally a brick wall. If you're moving at this brick wall and you're gaining momentum from all the dysfunction that has been going on from stress, that's a much bigger impact and a lot more quote unquote damage done because that wall is not moving. So a lot of women are told that their blood work is normal during this time, or it'll be very what we call non-specific. Sometimes we'll see inflammatory markers are elevated, or even some autoimmune markers might be elevated, but nothing like a disease. The rest of the blood work will not confirm a disease itself. We might see very subtle signs that something's wrong with the immune system. I have a lot of clients who have low white blood cell counts, and they're told that it's just normal. There's nothing normal about a low white blood cell count. So if that's showing up in your blood work, that means it's much more severe elsewhere. When we do vitamin and mineral testing in functional medicine, we actually test the white blood cells themselves, a subcategory of white blood cells called lymphocytes. And very often we'll find in women who have low white blood cell counts that they're missing a bunch of nutrients in those white blood cells, which is why they can't function. And those same women might be protein deficient from potentially malabsorption because, again, the gut is not functioning on all cylinders when you're under stress. So a lot of malabsorption happens during perimenopause. If you're not absorbing enough protein to keep up with your demands, you're not absorbing enough fat to keep up with your demands, your body can't make cells. The white blood cells are made up of proteins and fats. And if your immune system is suppressed on top of that, because again, when we're under fight or flight, we're under stress, our immune system is suppressed. So the body will not be making a lot of immune cells to replace itself. So all of these things are happening, contributing to the same result, which is a low immune system. And that could show up in blood work, although the vast majority of the time it doesn't. So we get these non-specific random abnormalities in the blood work where we can't really diagnose a disease. We can't say something distinctly is wrong. So we're told that everything is normal and that this is just a normal thing that we're going through because we're getting older. And again, it's simply not true. Perimenopause can be a functional imbalance due to stress. And it's not a disease, so it's not going to be found in the blood work. There's no blood work for perimenopause or even for menopause. We often think that the follicle stimulating hormone blood test, or FSH, is diagnostic of menopause, but it's really actually not. Menopause is a clinical diagnosis. It's not based on testing. So by definition, menopause is the absence of a menstrual cycle for 12 consecutive months. And that's all. Now, very often we will see that the FSH goes up around this time, but relying on the FSH alone is not diagnostic for menopause. And so even that we can't rely on with blood work. So the reason that burnout causes all of these symptoms is because it erodes the foundational pillars of body function. It erodes our nutrition. It erodes our ability to detox. It erodes our ability to restore ourselves and get restful sleep. Because when you're under stress to the point where you have burnout, your body is a little bit more hypervigilant because it thinks there's a lion somewhere. It's going to be easily roused as opposed to able to be fully at rest. A lot of sleep disturbances occur around this time. Exercise, if we're not moving according to our body's metabolic needs, we can do damage by even exercising. So if you're running, for example, long distance running or doing high intensity interval training, but you're depleted and deficient, that's actually going to make you worse. This is why I developed dynamic metabolic typing based in traditional Chinese medicine theory that I use with my evaluations to help support my clients. So knowing what to eat, how much sleep you need, what type of exercises best suit you, and how to properly and safely detox are critical to get those 4 pillars back up that burnout and stress knocks out or erodes. If we don't have those 4 pillars backed up and running, just starting on hormones is not going to help as much. It might mask your hot flashes and night sweats, but it's still going to leave you open to diseases. Getting on sleeping pills is not going to help because that's still going to introduce the risk of diseases. So while, yes, you can get on sleeping pills, anxiety medications, antidepressants, weight loss drugs, these things don't fix the root of what's going on. They will not correct the 4 pillars. They will not get those 4 pillars back up and running. And this is why, despite using all these medications and drugs, people still don't feel well and they're still at risk for these diseases. So the 4 pillars of wellness, eat, move, rest, and detox, are the 4 critical pillars to get back up. And through the use of dynamic metabolic typing, you can see where your body is in terms of its metabolism. Is it too weak? Or do you have excess energy in your body in the form of toxins and inflammation? So not all energy is good energy, right? Your metabolism might be still holding its own, but you may have a bunch of toxins and inflammation. We call that an excess dynamic metabolic type, as opposed to a deficient dynamic metabolic type. A deficient dynamic metabolic type is someone whose metabolism is low. Now, they may still have some inflammation and toxins, but their dominant pattern is one of deficiency. And when you do the burnout assessment, you'll be able to answer the questions there and you will know your dynamic metabolic type. What that will tell you is the pattern that is underlying your symptoms. Is it a deficiency pattern or is it an excess pattern? And then also temperature matters. So there are 6 dynamic metabolic types. There is deficient and excess as one subcategory, and then temperature comes in. So you can have a hot, cold, or temperature neutral deficient, a hot, cold, or temperature neutral excess dynamic metabolic type. What that tells you is where your metabolism is and how it's out of balance. What we call hot in traditional Chinese medicine would be the close equivalent to what we would call acidity in our regular medical model. So someone who is, for example, a hot excess dynamic metabolic type has a hot inflammatory condition, or they're very highly acidic. So that could be because of, again, toxins in the system or inflammation, or sometimes that's due to an infection, creating inflammation and toxins, leading to an excess hot dynamic metabolic type. So some things that could be triggering inflammation in a hot excess could be heavy metals, for example. We're seeing more and more of these things now. We're seeing lead. I just diagnosed a woman with lead toxicity the other day. Mercury in our fish, in our oceans. We're seeing a lot of tungsten from the computer industry, aluminum, nickel. These are almost ubiquitous now in the environment. And so someone with a hot excess dynamic metabolic type may very well have heavy metals in their system. Now, someone, for example, who's a cold deficient dynamic metabolic type, what that means is there's a cold process going on in the body. People with a hot dynamic metabolic type will feel warm compared to other people. It doesn't necessarily mean that your body temperature will be higher than 98.6. It can still be normal, but you feel warm compared to other people. You're the one that wants to blast the AC when nobody else does. And you're the one throwing off your sweater when nobody else is hot. On the other side, someone who's cold will feel cold. And sometimes their body temperature will be too low. I've had clients feel cold all the time and their body temperature is 96 degrees, 97 degrees. But they've been that way for a long, long time, so they think it's normal. But there's nothing normal about having a temperature, a body temperature that's below 98.6 all the time. So that allows them to perceive themselves to be cold. Coldness in your body can be an inflammatory condition, or it could be the absence of things that would keep your body temperature higher. Thyroid, adrenal hormones, like, for example, cortisol. Cortisol maintains body temperature as well. And so, again, if you're under a lot of chronic stress, there's a way that you could be too hot if your cortisol is too high, or your DHEA is too low, because that's a cooling hormone that calms you back down from the stress. Or if you're cold, you could have low thyroid, low cortisol. When things are cold, they're sluggish, so that affects circulation. When things are hot and acidic, that could also affect your circulation by drying things out. So you want to know exactly what side of the coin you're on, because how you would treat that, how you would bring your body back into balance would be completely different if you're too hot versus too cold. The treatment modalities that we prescribe in our Wellness Warrior 9-week transformation program are distinctly based on the dynamic metabolic type, because the point of the dynamic metabolic type is to know how your body is out of balance. Where's your metabolism and how is it out of balance? So that you can bring it back into balance through how you eat, how you move, how you rest, and how you detox. So someone that has a hot excess dynamic metabolic type, we would guide them through a very gentle cleanse to get those toxins out of the system. Whereas someone that's cold deficient, they have a depleted metabolism, we would never recommend a cleanse or a detox to someone who's deficient, because that will simply make you worse. And it'll make you feel even more toxic and depleted after, because things that cleanse and detox drain. We're purposefully draining something out. So we don't want to drain out depletion, because then we just get more depleted. So for them, for those that have a deficient dynamic metabolic type, we don't want them to cleanse, but we want them to really focus on the other three pillars: eat, move, and sleep, so that those are back into balance. Once those three pillars are into balance, your body should naturally remove toxins. So we don't want to force the body to remove toxins in a depleted state. We want to actually strengthen the body so that it can do its own detoxification. So when someone has an excess dynamic metabolic type, we might have to gently force the toxins out, because that's a different presentation. So when we drain out something that's too much, that's okay. We're just taking out the stuff that's too much. So we're leveling everything out. When someone's depleted already and we're draining them out, that means we're making them even more depleted. So we want to build them back up and allow the body to do that work for them. And that's why handling these things in a very balanced way is so, so important. This is why the dynamic metabolic type is so important to know. You can also have a temperature neutral dynamic metabolic type. That means you're not too hot, not too cold, you're right in the middle. So they have a little bit of an easier time, but you might have an excess temperature neutral dynamic metabolic type as opposed to a deficient temperature neutral dynamic metabolic type. And again, you may have the same symptoms. So people with hot excess or cold deficient, you may have very similar symptoms. Someone with a hot excess dynamic metabolic type might be tired, might be gaining weight, might have trouble sleeping. Someone with a cold deficient dynamic metabolic type can have those same symptoms. It's just that the person with the hot excess might feel warmer. They might be the ones that are experiencing more hot flashes, as opposed to the cold dynamic metabolic type that's deficient that might be experiencing chills. So this is how the temperature matters. How you get things back into balance is you do the opposite of what you are. So if you're a hot excess, you want to cool yourself down. An alkaline diet would be more beneficial to someone with a hot excess dynamic metabolic type. If you're cold, you actually want to warm yourself up. So you want warm, well-cooked food a little bit spicy. If you're hot excess, you don't want a lot of spices, and you don't want highly acidic foods if you're an acidic dynamic metabolic type. So we parse all that out so that it's very clear how to rebalance the body and get the 4 pillars of wellness back into balance so that symptoms go away, not because they're being masked, but because the root causes of them are being treated. So that's just a sample of how we would manage dynamic metabolic typing in the Wellness Warrior 9-week transformation program. What this also does is it allows your body to actually recover from the stress. When your body is getting what it needs and getting out of its way what has been in its way, it gets to restore itself more. Now, of course, that means we have to also introduce the things that will stop the fight or flight responses, which is breath work, meditation. All these things are necessary to turn the switch off to fight or flight to allow the 4 pillars of wellness to be back up and running so that what you're doing in response to your dynamic metabolic type actually works. And so it's a root cause based strategy to get the body back into balance. So perimenopause isn't the beginning of the end. It's actually a second chance to thrive in the 3, 4 plus more decades of life that come after menopause. So when you take that opportunity and you listen to your body's distress signals, it's an opportunity to reset your metabolism, rebalance your system, and finally address the burnout that's been silently building or not so silently building for years. When you take advantage of this opportunity, you get to reduce your risk of disease while living vibrantly, healthy, and joyfully. You don't have to live with these symptoms. You don't have to live with hot flashes or fatigue. This is your reset moment. So if you're ready to take this second chance seriously, I designed a 7-day Burnout Reset Challenge. It's designed to jumpstart your metabolism, take your power back from stress and burnout, and start easing symptoms of fatigue, insomnia, hot flashes in just 1 week. You'll get daily guidance, support, and tools to help you start building resiliency immediately. We've had amazing results with our 7-day challenge. I just had someone send me a message the other day that her hemoglobin A1C went down by 0.4 points, which in the hemoglobin A1C world is a huge win. Her hemoglobin A1C had been steadily climbing to the point where earlier this year, her physician wrote her a prescription for metformin that she didn't want to fill, and she actually didn't fill. She went through our 7-day challenge and had her hemoglobin A1C repeated, and it had gone down for the first time in years. And so her doctor said she could stay off the medication and she didn't have to start it if she didn't want to. We've also seen our clients losing weight within the first week, sleeping better, just from the simple techniques that we teach during the 7-day challenge that you can take with you for the rest of your life. It gives you a quick glimpse into our Wellness Warrior 9-week transformation program and see just how powerful these shifts can be. You can join the challenge by clicking the link in the description or visiting our website, awakenedwellnessnow.com. And if you love your results, you'll be ready to step into the full 9-week transformation program. Let's use this moment to step into our best lives, put the lid on burnout and hot flashes, empower yourself to live disease-free, happy, and joyful as you deserve. For more information, visit our website, awakenedwellnessnow.com. You can also learn about our corporate burnout resolution programs there. If you got value from this podcast, please share it with someone you love who might be suffering through these symptoms. Please like and subscribe to our channel. And until next time, many, many blessings. Thank you.